Time now for this week's Health Matters. Paul Critz with you, along with physician assistant Lynn Szabo. And Lynn, today's topic I've never heard of.
You probably suffered from it, though.
Really? Okay.
I imagine so.
All right.
So, allergic rhinitis, but kind of behind that title, there should be a subtitle of like allergies, eczema, hay fever, asthma, hives. It's all kind of related.
They're all related? Okay. All right. Interesting. So, and I've never had any of those things, so...
Yeah.
Okay, all right.
Yeah.
How are these things all connected?
Well, we'll use the portal of allergic rhinitis. That means runny nose. Okay, so when you go to the doctor and you tell them you have a runny nose and they say, you have rhinitis. That's not really a step forward. But
I don't have any problem with rhinitis.
So anyway, that's inflammation of the upper, like the airway passages, including the nose. So nasal congestion, itching, redness and puffiness, sneezing, watery discharge. So a lot of people are suffering through it right now, which is why it was on my radar. And like I said, it's closely related to diseases like asthma and eczema. But it's a clinical diagnosis, and it can be kind of depending what the trigger is, it can be year-round. Like for somebody who's allergic to dust mites, for example. Those are the creepy, crawly little bugs that live in our bed that are not bed bugs. They're smaller and grosser looking.
Are they related to the ones that live in our eyelashes?
Yeah, they're kind of our little cloud of ectoparasites.
So many people are disturbed by that. I am not disturbed by that at all. I kind of feel like Noah's Ark walking around. I like it.
I know.
I'm never
I think
alone.
It's cool. It's yeah. Like I have peaceful coexistence.
Yeah,
going on
exactly.
myself. But anyway, or it can be year round. Like I have allergies year round, but my particular time where the planet seems like it's trying to kill me is the first week in August. So that's why I thought of it.
Okay, so is allergic rhinitis separate from, is there just a straight up generic rhinitis that just is runny nose?
Sure, rhinitis is runny nose. So
Gotcha.
You can have a runny nose for a lot of different things. So it could be allergies, it could be a viral syndrome, it could be everybody hopes it's bacterial, it could be you could be a little kid and you stuffed a popcorn kernel up your nose. I mean,
you could have cried for some reason, right? Anything like that. Yeah, sure.
Totally.
Okay.
So anyway, it's a clinical diagnosis, and the main treatment they tell you to do is like avoid the allergen, which is like simple and so complex.
Yeah, easier said than done, right?
And if you're an allergic person and you're allergic to pollen in an area, and let's say you're allergic to our temperate rainforest, because we live in a temperate rainforest, at least for the moment, and you like move to Phoenix because it's a completely different environment, you're going to kind of develop an allergy to Phoenix in about 7 years.
Okay.
So you get dogged. Anyway, so there's... we're seeing it increasingly in Western and developed countries, and they think that it's consistent with developed countries having a decrease in the amount of infections, and so an increase in the amount of allergies. So remember, this is an immune system phenomenon, right? And so if the immune system doesn't have infections to fight, apparently it goes after
It goes looking for something to do?
Yeah.
Oh, wow.
So and its most important job is differentiating between external threats and internal normalness.
Oh, my God. Okay.
And it's a fail on its part, I think.
This is dovetailing with so many conversations and thoughts I've had recently. Lisa and I, my wife and I, were just talking this week, earlier at the end of this week, about how, are we crazy? Does it seem like, okay, I grew up and you know how you have those deathly sort of peanut allergies everybody's got to be afraid of now?
Right.
That wasn't a thing when I was a kid.
It wasn't.
So I was wondering, is it because we just weren't aware of it and paying attention to it?
No, it wasn't a thing.
So is it because we have been so successful against viral attack and
fighting infection?
Wow! Oh,
Yeah.
any
Any
infection. So viral effects, septic, all of that stuff.
Right.
And so the allergies are kicking up.
Increased hygiene being a big culprit.
Wow!
I know. I was blown away too.
So in the battle, dark ages in the past. With the classic surf dressed in rags.
Yeah, I think Monty Python,
Didn't have allergies as bad
rolling in the muck. They didn't have them as much. They probably had the capacity for it, at least on some level.
Sure.
Otherwise, it wouldn't have kind of shown up today. But
Interesting. Okay, I also have a whole topic that I want to discuss with you vis-a-vis the Delmort cruds. You know,
Sure.
right? Okay, and it seems like what you just said, you're describing that very thing. When people come here, well, every year there's people who every year at a change of a season will get that for no apparent like sickness reason, right? And then especially if you just move here, if you just come here and move here, first couple of years when the weather changes, and then all of a sudden you're walking around with what you think is hay fever or something like
It's
that.
part of it, yeah.
Okay.
It's probably multiple things.
Yeah,
And
yeah.
I know when I lived in Humboldt, I think it had something to do with the stacks. You remember the lumber mills? Remember
my
when
God,
Eureka
yeah.
smelled like
I remember when Elk Valley Road smelled like a fart in a wet paper bag.
Yeah. That's it. But we digress.
Yes, we do.
So we're seeing increasing allergies in older kids, so first kids. Okay.
All right.
Kids raised in urban housing, exposure to pollution, and my favorite one, indoor dampness, which is kind of defined still north.
Yeah, that's the thing up here, right? Yeah.
And then they think antibiotic overuse is causing changes in microflora, and that's causing people to have more allergies.
So just basically our whole modern life is what you're saying here. In that
I think as we move toward better hygiene, our body has a downside to that.
Mm-hmm.
So you see decreasing allergies in younger kids. I think it's first-time moms tend to keep babies, cleaner and housekeeping cleaner.
Mm-hmm.
I think that's what they're getting at. Early daycare exposure can be how kids get sick constantly at daycare.
Mm-hmm.
That can be a good thing with regard to allergies.
Yeah.
Exposure to farm animals, especially when a pregnant woman is exposed. So that fetus, when it goes on to being a human being, actually they have decreased amount of allergies.
Mm-hmm.
They don't really know why. And my favorite one, people with worm infestations.
Is this the gross part you warned me
This
about?
is the gross part.
What the hell is this?
I didn't warn you. I expressed joy.
Yeah, I took it as a warning. Sorry.
Right.
Go ahead. Yeah.
So worm infestations, actually, I've seen this sometimes on some fictional medical shows, that worm infestations are associated with a really, really remarkable, like 80% decrease in asthma symptoms. And so if you can keep the little guys at a nicely managed colony, I guess.
They fix your asthma?
Yeah, they're looking at whatever it is that happens seems to make asthma better. But in the South, you used to have a lot of hookworms, right?
But a specific kind of worm?
Hookworms is one.
Hookworms.
Yeah.
Okay, but then that's widespread
That's
all
one,
around the world.
but there's more
right?
than
Yeah.
one.
Yeah, okay.
So, in the South used to have a big problem with hookworms. It was endemic, and so they didn't really see asthma much, and they think that's why. There's a protective effect.
It never occurred to me to look at health, at illness, at well-being in that regard as being such a balancing act. Like I just thought, oh, you're sick over here, you deal with it in this way, or you have this
Right.
sort of thing, you deal with. It's almost like I was looking at it too atomistically and didn't see the interweaving and how.
Oh no!
Yeah.
And I also think it points the finger at gut flora. On a macroscopic way, but there's also a microscopic. So our gut flora takes hits all the time. Unnecessary antibiotics, poor food choices.
Right.
Other medications that can affect the gut. And so I think what we're seeing, hygiene like toilets apparently are downside for allergies. So, so anyway,
So would you say?
yeah.
Okay, so this goes
Who
back.
would have predicted?
Wait, no. What are you? So what are you saying? Just explore. I want to know more about that idea connecting the gut flora with perhaps this change in allergens or allergies.
Well, so does science. So what they're seeing in the most general sense is that they're now recognizing the intestines as part of the immune system.
Okay.
And if you think about it, it makes sense because what do intestines do? I mean, a human being or any mammal probably is, on a bird, is kind of like a donut, right?
Yeah. Yeah.
Okay. And so there's intestinal protection lining the whole tract from, how saliva works and all the way down to the rectum. And so it makes sense that as different substances move through the gut, that the body is going to have a reaction to that, because it could be a substance that's maybe not so good, like a toxin. It could be, like a parasite, and the immune system's going to respond to that. So I think what they need to do is figure out what's upsetting. How is the immune system reacting to say worms, a parasite infestation, what's that mechanism? And then can you do it without the worms?
Exactly.
Is the bottom line there.
Wow.
So, so this is a whole different way of looking at intestines.
I think down the road, I would love to see a Health Matters that concerned with or dealing with just that the growing knowledge around the role of the gut biome, the intestines, emotionally, immune system, all manner of things are affected by that. And I think we're just coming around to the fact, no, it's not just a food bag that you fill. It's got a lot to do. I like the linguistic aspect of, your gut feelings, and how you've got your heart and you've got your emotions and they're all centered right here in your abdomen. And that seems telling to me, that seems to mean something.
Yeah, who needs brains?
No, that's not what it just means. That maybe there's an accuracy to that sort of characterization of our feelings physically.
Yeah,
kind of Egyptian. What do you mean?
Well, the Egyptians thought the brain was
secondary.
Yeah, not really a big deal. Yeah. And they looked at the heart, right? So anyway. So most common treatments are this is all straightforward. Over-the-counter antihistamines like Claritin or Zyrtec. So that's loratadine or cetirizine. Allegra is kind of in the running there too. Intranasal steroids, and the biggest one that's over-the-counter is Flonase. Allergen avoidance. So that's like actually, I would think if a mom that had a kid with dust mite allergies, there's ways you can change the bedding or change the environment of the kid's room.
Sure.
Because think about that. Let's say we spend 8 hours of sleep, like Joe average, 8 hours of sleep out of 24. So whatever it is we're exposed to while we're sleeping in the environment is going to be, anything you're exposed to more frequently is going to be a common trigger for allergies.
That's so weird.
Does that make sense? Because
it doesn't.
That is the opposite of what providers ask. They always ask, "Is there anything new?" But really, the question is there anything old?
Right.
And but there's no way to answer that because everything's old. Really, I mean, we're repeatedly exposed to dust mites. From the time we're brought home from the hospital, probably. So. But you can change environments in really clever ways to decrease avoidance without like moving to Phoenix. Okay.
Sure. I mean, well, it's a stupid, quick little something. I've got a cat that's allergic to, I'm not sure what, but just regularly vacuuming my house keeps it down, keeps his attacks down, keeps his episodes down. And that's just a matter of simply removing stuff he's obviously breathing in. So
if somebody's allergic to cat dander, this is bringing it back to humans. That's a really important thing to do, but the person who has the allergy should not be doing the vacuuming.
Oh, yeah,
it should
exactly.
not be in the house for about 2 hours after.
No, because it
aerosolizes everything.
Yeah.
So, but the most effective allergy preventative that I ever saw, as far as the data, is taking a rinsing shower before you go to bed.
Really?
I know. I thought, like, what?
Just washing stuff off your body?
Oh, my God. Because we're like a little piece of Velcro.
Yeah, I guess we're pretty sticky.
Yeah. And pollen and stuff. Let's say somebody's allergic to grass pollen. They have it all over their body.
Wow.
So if before they go to bed, I'm assuming clean sheets.
Yeah.
They take just a rinsing shower. So pretty much... neck down.
Yeah.
I suppose you could go further and just rinse your hair, but you'd be going to bed with wet hair, and the grandmas would get upset. But that actually has decreased allergy symptoms a significant amount.
Wow.
No side effects, really. Easy to do, super easy with kids, I would think. You could use soap and just make that your cleansing thing, but it's more of a rinsing thing.
Right.
Yeah.
That's interesting.
So that's treatment for allergies, too.
It seems like it would be pointless unless you also start all of that with clean sheets.
Right. You have to start with clean sheets.
Yeah. And keep the sheets clean because you're rinsing. Because if you
no,
don't,
that's assuming that you're not allergic to dust mites, because that doesn't address dust mites. But that keeps you, if you're like allergic to redwood trees, then, or mold, for example, then that really helps bring it down.
Right. Wow.
And other things for kids' rooms, like you should have wooden floors, not much in the way of carpets, no stuffed animals in the room, which would have shattered my kids.
Yeah.
But no pets sleeping also is hard to do.
No, one of my kids' stuffed animals was a way of life. That wasn't a possibility.
Oh, totally.
Yeah.
Right, completely. And then no mini blinds.
No mini blinds,
Mini
really?
blinds are kind of a deal. So there should be cloth curtains and they should be laundered.
Okay, yeah. If you've got cloth, yeah, sure, that makes sense. I was going to see the cloth curtains would hold on to stuff worse than the mini blinds, but you never clean the mini blinds. But you could
Or
wash the
even when you
curtains.
clean them, it seems like dust likes them.
Yeah, right. Interesting.
And then you could get referred down to Dr. Ramos, the allergist in Humboldt County, and she could set you up with allergy shots. But that whole process is super ponderous, and I don't know that I see that it really helps people. Mm-hmm. Maybe for some people.
Is that a thing? Is that a thing? As our allergen and allergy scene has changed over the last couple of decades, I had a cousin who was allergic to a lot of things, had to go for shots. Mm-hmm. I forget what, and I don't know why. I was a kid. He was a kid. I just don't hear about that happening much anymore. Is that a way that our allergies are dealt with, or are allergies so different now that that's not a way to deal with them anymore?
Yeah, I don't think it's super effective.
Okay.
And it might be people who are allergic, have an allergic kind of phenotype or something. They're allergic to a lot of things, and the shots are kind of a mix of like 2 or 3 things.
They're like
maybe
more
3 to
specific,
5
right?
things.
Yeah.
And they also have to be specific to the area you live in. So let's say, your insurance, for some reason you can't go see Dr. Ramos in Humboldt County and you have to go see the allergist in Reading or the one in Medford. Mm-hmm. Are they, do they understand that you have different exposure? It's a different climate stuff. I think the process is ponderous, and I know it has to have a scratch test, which is called a RAS test before, and they stopped doing that during COVID and really haven't started doing it. So I think it's expensive. I think insurance goes, hey, Zyrtec is cheaper.
Right. We can just throw something at it.
Right. And then it's just there's a huge number of people that need it in a very complex way. So it's just not a useful tool.
That makes sense. That makes sense. It would be. And am I misunderstanding what you've said? Is it are just allergies now? Allergens now are allergies the way they're experienced by people are just much more kind of widespread, contextually environmental as opposed to specific substances that you're allergic to.
Right. And there's actually a stacked theory of allergen. I couldn't find any information on it, but I heard it in the hallway once, just talking to a colleague. And it's not like, you eat a peanut and you're toast, although some kids definitely have that. Mm-hmm. But it's more like, you eat a peanut on the day that the grass is mowed and it's been raining a lot and it was the first sunny day, and and stuff becomes stacked. You have stacked triggers. Mm-hmm. So it's just harder to fight that battle. The other thing too you have to remember with allergies that people don't is, like you say you're allergic to a shampoo, that's like 15 things.
Yeah, you're not allergic to shampoo. It's something in the shampoo.
If we take shampoo for an example, most things that are in shampoo are all the same. Like probably 10 things are all the same.
Right.
And what's different is things like fragrance and color and stuff.
Yeah.
It's also very hard. Dr. Ramos told me once that it was very hard to check for allergies to man-made chemicals. And that she wasn't able to do that. And so a lot of people's triggers are maybe food preservatives or something. And she didn't have a way to check for that.
Wow.
So,
well, that would make more sense than to throw Zyrtec at it, to throw a steroid at it.
But the insurance guy is sitting in the back going, Zyrtec's cheap.
Yeah.
Or even better, Claritin's cheap. Loratadine, which is a lot cheaper, but not as effective.
Wow.
Yeah. So I threw a little bit in about complementary and alternative therapies because I thought that could also be interesting for people, since medicine itself doesn't have a huge amount to offer. So they're traditional Chinese medicines, and they've been studied, and they do actually help. There's a widespread bunch of this. The downside is you never really know what you're getting, and sometimes there's toxic heavy metals and stuff. So make sure if you're getting it from somebody you really trust. They do increase the quality of life, but they don't change the symptoms.
What's that mean? How does that
I
work?
think that's placebo effect.
Oh, I thought I read
I
that
must
as
be better because I'm taking these herbs.
I read that as what does it do? Get him high? Is that what's going on?
I don't know. It probably depends what's in there. And then you're opening yourself to adverse events, which of course you could if you were taking Zyrtec or Claritin too, or Allegra. So this I thought was interesting. Acupuncture and acupressure actually showed modest improvement in symptoms, but I guess your chi doesn't stay in the right lane for very long. But these are not long-lasting things, so you have to continue it.
It's just relief right then.
Right.
And then, wow, I'll be darned. Okay.
And people didn't change their use of medication. So it wasn't like they felt so great for a period of time that they just threw away the over-the-counter.
But if you're having a specifically acute, like an attack or something, maybe some sort of reaction, maybe.
A period, I don't think you could rush to.
No, you can't rush down.
I don't even.
Different needlework happening in Delaware County.
Depending on your insurance, I don't even know how you could do it in California.
Wow.
Humboldt.
It's almost like you'd have to have one on retainer.
Yeah, be married to one or something. I know somebody who does that.
Really?
Actually.
Do you? Yeah. That's handy. Okay.
Yeah. And I'm going to say this wrong.
I am going to read it. Yeah, what is this again?
Ayurvedic medicine. This comes from continental India.
Okay.
And there is mostly herbs that are useful there. And it can be helpful, especially it's helpful compared to Zyrtec. But again,
this is just the Indian version of Chinese medicine,
Chinese
right?
herbs, yeah. They probably have different ones, but I don't know because I'm not sure what the environment's like. But I think India, you're more likely to have like temperate rainforest, and I don't know. It's totally different. Hard to say. So herbal medicine in general, like butterbur, which combination of cinnamon bark, Spanish needle, and acerola, which I think is kind of vitamin C, mint, and others. If it helps, then it helps only temporarily, and side effects are an issue. Again, do you really know what you're getting and what's in there? There could be contaminants and things like that.
I want all that to work so badly, and it's just
Butterbur, the reference I read about that, actually there's some good evidence to suggest that it can be helpful in a temporary way, but it could take your liver out.
Oh, God.
So weigh the risks and benefits, and I would say talk to your provider about it, but most providers are going to go take the Zyrtec. Yeah. I think, because you don't really know what you're getting.
There's a lot, and these things that may or may not work, all of that, I don't know. I've kind of given up any sort of that kind of, I mean, it's not text, but that pop cultural sort of, holistic medicine, ancient Chinese secret, that kind of thing. When I had a kidney stone and experienced Toradol, I'm like, thank you, Western medicine.
When something works, it's going to be immediately widely available. You can look at HIV. When they found protease inhibitors, like there was no keeping that aside.
Right.
So, what's available, what you have that'll help is definitely what moves to the forefront. And things that are kind of maybe, I don't know, maybe you get in placebo, you can get 30% out of placebo.
You can get a buy, yeah.
But better is better, as long as it's not causing any problems. But, if you were a provider working in the ER and you said, hey, let's give you some normal saline and see what the placebo effect is. That's not going to go anywhere.
I want my money back.
Yeah. So.
Oh, my God. Yeah. So your last line here on the email just had me cracking up. So leprosy in Florida, was this a possible a topic for next week?
Yeah, because I was, the infectious disease provider in me was like, what? So, it's such a biblical thing.
Yeah,
Florida, could this be a little reminder from God? Who knows?
I saw on the news this last week about the resurgence of leprosy in Florida, and they showed somebody with leprous hands. I'd never seen leprosy before. Oh, that's gross. What leprosy looks like. Oh, okay, that's nasty.
So disfiguring.
Yeah,
but, it's also really, really hard to get, and really, really easy to treat.
Really.
Yeah, it's a mycoplasma. That's kind of interesting.
I'll be damned.
Mycoplasma is one of the organisms. Remember, like saying mycoplasma is like saying apples. There's a
Okay,
lot of
yeah,
different kinds.
yeah.
But it's one of the organisms that we think contributes to Del Norte crud, and that's why somebody moving new to the area might just have a novel experience with our own little brand of mycoplasma.
Wow. So in some cases, a type of that what is it? Is it mycoplasma? Is that what you called it? So can result in leprosy in another place, another context, the same,
No.
a similar, not the
No.
same thing, but
You're mixing leprosy mycoplasma with Del Norte crud.
no, I'm not. You didn't let me finish my sentence.
okay. Calm
That's
down.
something the family, a mycoplasma that
Right.
not the same one that creates leprosy, but that
Right.
same sort of thing.
It's a difficult family of.
Sounds like a difficult
Yeah, it's difficult to treat. It causes a lot of different disease.
thing. Right.
And it's covered with like a little slime envelope,
Oh,
and so
wow.
that makes it evolutionary. That's good for it, but
Yeah,
hard for
yeah.
us. So anyway,
Dealing
but I
with the slime.
digress.
That's okay.
Yeah.
That's all right. We've reached the portion of the show in which we digress.
Oh, okay.
So, so are we sticking with that? Are you coming back with the leprosy this next week?
I
or?
am, but I'm tempted to talk about barriers to care.
Barriers to care was a very
Because
real thing this
that-
week. For
This was Barriers to Care week in kind of a lot of different ways. I saw a lot of like ridiculous barriers to care, and I wonder, it almost feels a little personal, Del Nordians. I'm feeling,
well, okay. So first off, what is the actual barrier to care?
well, there's
Barrier
so
to-
many.
Are there though, or is it just one?
Poverty.
Yeah.
Is that- yeah.
Yeah, money.
Yeah. Money. I would say money. If
Yeah.
I had to pick one, I'd say money and lack thereof.
Because so we both know somebody who was now you characterize the surgery that this mutual friend was going in for as being, like sort of, if I remember correctly, this is how it existed in my head. It's like it's minor surgery, but really important and perhaps or really necessary and perhaps even dangerous.
I wouldn't call it minor. It's significant surgery. He had a great surgeon.
Okay.
That's what mitigated his risk.
I guess, okay, so in my layman's mind, minor surgery is anything doesn't open up your chest. So yeah, okay,
okay.
but it's not
All right.
minor. Yeah, exactly.
Right.
It's-
He needed.
It would basically, and it's also like in one day out the next.
yeah,
That's like
vascular surgery. He needed to spend the night. It was significant. It has risk, but risks that are manageable. And
Mm-hmm.
he was in the hands of a phenomenal, wonderful,
That's what you've said.
amazing, dedicated to Del Norte and Humboldt County surgeon, vascular surgeon.
And
So-
this person could not get to St. Joe's in Eureka under his own power, and was told that, and I don't know, several entities were involved, government and healthcare, and that gray area between the two, where poor people live. Where it was told, we'll get you a ride. We have this whole service, this whole ability to deal with this. Excuse me. And no, it couldn't happen. And because
At the last minute?
At the last minute. Well, I don't know at the last minute. It might have been several days before, because nobody ever bothered to call him and tell him. So it's 6:30 in the morning. He's standing out here waiting for this ride. 6:37 starts the phone calls. Takes a half an hour to realize, oh, this wasn't going to happen at all. I guess maybe I can see if I can reschedule this surgery. So it's just so frustrating. It's just money. And the system that we are told, and we're told this with every modern system, oh, it's going to work. It's great. We've got it all in place. This is user friendly. It's all blah, blah. Just is crap. We're just not capable of running these systems
Yeah, you have
anymore.
to ask which user thinks it's friendly. Anyway.
Yeah, good
and
point,
it's not
good
the
point.
user we're talking about.
No,
So-
it never is.
Yeah, you could talk EHRs, and that whole thing is kind of like that. But anyway, yeah. And, it's operating time at one of the kind of like more ready to handle complex problems hospitals in our area. And, and this incredible surgeon. I'm wondering if they all knew. If the medical people knew. I think maybe the only people that knew were the transport and the insurance
Right.
agency, not the patient, not the doctor.
Yeah. The people involved in this whole
yeah.
thing who needed to benefit from this whole
So a
dynamic.
lot of resources tied up and wasted for kind of a stupid reason.
Yeah.
Yeah. So yeah, we can talk about barriers to care, and I actually know, had an interesting barrier to care that was kind of like melted because I had a medical assistant who read the past records and was able to we were able to get printed proof, but I can talk about that next week. Barriers to care are like beyond ridiculous here. And there's so many different kinds, and they don't, under similar situations, don't really seem to exist in Humboldt.
Wow.
I don't know why.
And Humboldt is not that different. It's just a different sort of scale.
I don't know. I don't know. People are more likely to have phones. I don't know. Poverty is definitely a part of it. And I think the other part is medicine's and insurance reliance on tools that don't work for random people.
Right.
Random patients.
Yeah. It does seem like, and I see this with every sort of system I encounter, whether it's an online phone tree thing, you have to phone menu, you have to get through.
Or just download this app.
Anything that the system, it seems like the people who design it and propagate it never actually have to use it.
Right.
And so they don't understand how it falls apart and what it means when it does fall apart. Yeah.
Right. They
Hey.
also don't live here.
That's it.
They don't know what the slide's like, stuff like that. Anyway.
Yeah. All right. Well, there you go. So I don't know. We'll see what happens next week. I leave it in your capable and talented hands. Thank you, Lynn.
Yeah. See you next week.
All right. It's Health Matters. Thanks, everyone.